adequate funding for London's teaching hospitals?
Well, let's talk about people for a moment. Let's talk about my Grandpa Chapman. My Grandpa Chapman had his terminal disease when he was in his late 80s, and he refused to go to the hospital. He refused to go to the hospital because he told me that's where people go to die. The reality today is you can't even do that. I spent Saturday afternoon with some doctors and nurses from the cancer center, and they were telling me stories of terminally ill patients that had to be turned away because there weren't beds for them. They could not get them admitted to the hospital. I want to look at this document that you folks provided for us tonight and read some of the lines here. Mr. Bentley talked about all the money that had been put in. Let's talk about money just for a second, too. The Liberals have increased our taxes by 33% over 4 years. Mr. Ramal mentioned the other day that they spent, I think, an additional $9 billion in health, and that's laudable. We need that kind of expansion of spending. The problem is, the question we have to ask ourselves, are we seeing results? I look at this and I see the terms no additional funding, little or no compensation, underinvestment, inadequate funding. The problem with hospitals really is hospitals don't create demand. It's patients that create demand. Governments put restrictions and limits on hospital, and Cliff and I have talked about this on television, on my television program. They put limits and demands on a hospital, they mandate programs, they don't provide the funding for those programs. It is the belief of the Progressive Conservative Party that it isn't an issue of not enough money. The provincial budget this year was $91 billion, up from $69 billion just 4 years ago. So it's not an issue of money, it's about where the money goes. It's about how the funding is used. And we have a commitment to working with frontline people. The docs and nurses who are on the front line of healthcare, who see where the rubber hits the road and see where the inadequacies are, and in some cases see and can say, we're doing very, very well in this particular area. Perhaps we could move some of our resources to an area where we're not doing quite as well. That's what we're all about in hospital funding. The money's there, it has to be used properly.
You know, the question we're asking at this point is how we can ensure adequate funding for all of the various wish list items that the government requires a hospital suddenly to fund without providing any money. I think a good starting point is to recognize how much money we already spent. 59% of every Ontario tax dollar you pay, sales tax, provincial income tax, you name it, 59% of the taxes is spent on healthcare. If I ask this room, well, why don't we just double spending on healthcare? You might all say, yeah. But how would you do that? You'd have to crank taxes up so high that nobody could afford to buy their breakfast. The problem we're having is not that there's not enough money in the system. The problem is that the demands on the system are being set for political reasons by politicians who want to promise you everything can happen. You can have everything, the latest, the best, okay? But, and don't worry, we'll get the money somewhere. Well, the money is coming out of your pocket. That's where it comes from. And every time they make a promise to give you a golden MRI machine, what they're promising is to take even more of your money and spend it on an MRI machine so that you'll re-elect them. The way to make sure that hospitals have the money they need to operate is to make sure that patients, not politicians, tell the hospitals what it is they need. And they do that simply by arriving and saying, I'm ill, assess my illness, and then you as a doctor, not as a politician, as a doctor, tell me what's medically necessary for me to get better. And then you tell the hospital administrators, this is where the demand is. These are the things we need to serve our patients in this area.